We had a lot to cover in this week's chapters about office management and medical office management. I am interested in the office management side of the practice rather than the clinical side. Today I'm going to talk about the administrative office manager's role in a medical practice. This person fills a very, very important role in making the practice run smoothly and making sure that all the administrative tasks get done on time. In the article, 4 Traits of a Successful Medical Office Manager, the author, David Arnett, says, as facilities continue to implement electronic medical records, the role of the office manager is more important than ever before. Because of that, facilities are putting more emphasis on the traits of good managers. He then identifies 4 things that an office manager must have to be successful. 1. Ability to see the big picture. 2. Be organized. 3. Communication skills. And 4. Open to change. I will now take each one of these skills and look at it further. A successful office manager must have the ability to see the big picture. The nature of a medical practice is that it is new each day. There are different patients with different personalities every day. There are also the dynamics of the staff, colleagues outside the office, and suppliers to consider. It is the office manager's job to weave all these needs and personalities together to facilitate a successful day. Medical practice is all about the individual patient and the doctor, but the office dynamics are not as individual. The office must run as an entity in support of the doctor and must be managed to support that doctor or doctors if the practice is large. To do so, the office manager must consider all consequences to decisions made, always looking at the big picture of providing support to the doctor. Second, be organized. The doctor, staff, patients, and vendors are all expecting the information they need to be available in the precise time they need it. The information needs to be accurate and properly filed in order to be easily retrievable. And a system must be in place for all information to have a home. The manager must insist that everyone understands the importance of information getting back to its proper home. The great added benefit of having an organized office manager is that the entire office is more relaxed. Working in an environment where one has the confidence that things are being handled is a great stress relief. Third, have good communication skills. All the talent and intelligence in the world is useless unless the person can communicate effectively to others. An office manager must be a master communicator. He or she needs practical knowledge of medical and technological terms in order to be able to speak with the doctor as well as the IT repairman. A manager must be able to empathize with patients who are hurting and fearful while still being firm on the policies of the practice. Perhaps most importantly of all, the manager must be able to effectively communicate proper procedures to the staff in a way that is not condescending or rude. Finally, the manager must be open to change. In the real world, the first attempt at something isn't always successful. In a medical office, the manager needs to be honest and humble enough to admit when something just isn't working and move to replace it. A willingness to evaluate systems also gives the staff a sense of belonging, as their input is heard and considered in decisions. The goal is patient care, and if that means changing things to provide improvement, then the manager needs to be not just willing to change, but eager to do so.